One of Pen Group's biggest sellers, biggest things is our Pen Clinical Handbook, which started a very long time ago. And Vera Todorovic is here to give us a bit of history of the handbook this morning to start us off, and then we're going to move through and talk to you about some of the new chapters that have been updated in the handbook. Thank you, Vera.
Okay, so it's my pleasure to introduce the pocket guide, talk a little bit about the history, and then just to move on to where we hope to go for the future. So the first edition of the pocket guide began in 1989. So how many of you in this room were born after 1989? So there'll be some of you that won't have even known about the first edition of the Pocket Guide. And before I talk a little bit more about that, what I want to do is to also just put a thank you out to people who were heavily involved with Pen right from the early days, because these were people who actually influenced the development of the Pocket Guide, as well as all the developments within Pen during the 80s and 90s, and then there are other people that came along at a similar time that are in the audience and that are still working for the aims of Pen. But I thought it was important to recognise the work that Doug had done, and Rita, Pat and Christine in the earlier days. So the Pocket Guide initially started really as a result of doing some workshops in the early 80s in the Trent region around nutrition support for dietitians. And I think what was evident when we started to do some of that work was that we didn't really have any starting points, and dietitians were coming along to the workshops and had very different ways of either estimating nutritional requirements, or perhaps they didn't really estimate nutritional requirements. So there wasn't so much, I suppose, consistent use of formulae or equations. And what we felt was important was perhaps to start to put together some basic tools that people could use, and that we would then promote within the dietetic profession. So it was really developed as a resource to support the clinical update courses, which became nationally available in 1986 after we'd done these pilot workshops. And it was really to provide basic guidelines for the dietitians involved in nutrition support. And it was initially supported by a grant from Abbott because we needed somebody to publish it. So Abbott very kindly said that they would do that. Now, if Anne and I had known, how successful the Pocket Guide was going to be, we would be millionaires by now. And we would be floating off on our Caribbean island somewhere. But anyway, we didn't. So that's what the initial first Pocket Guide looked like, and these were the contents of the first Pocket Guide, of which I have a copy if people are interested. And so basically we put together a short number of sections, 5 sections, one that was on that covered pediatrics, and the rest really covered adults. So we decided that perhaps there should be something about body composition. At the time, there was a lot about amino acids and the importance of making sure that people got essential amino acids in the diet, and if you were malnourished, it wasn't that easy, So we thought, well, we'll put something in about that. Estimation of energy requirements for adults, and when Liz talks in her next talk, I'm sure she'll tell you about how many years we've gone backwards and forwards about what energy requirements should look like. But anyway, we took a stab in the dark and went with Schofield and some adjustments for people who were patients that were sick, and we went with that. Yes, we had elbow breadth as a measure of frame size, so that was quite interesting. So that was to help identify whether somebody was small, medium or large framed, and from that we used some ideal body weight tools to determine what people's weight should be. So that was our starting point. And yeah, we had some bits in about nitrogen balance and then the children. And then what we also felt was that while we were trying to do calculations around what patients actually required, there wasn't a lot of knowledge about what was actually in solutions that people perhaps were already getting, or what in terms of clinical biochemistry, what people's ranges should be within reference ranges. So that was our sort of initial start, and that book, or that first edition, went on until we brought forward the second edition, which was brought out in 1997. And that was really, so all this time, I mean, it looks like there's a long gap between editions, but during all this time, what we had done was actually do quite a lot of developments in terms of, what we were going to use as sort of standard formulae or consistent messages with dietitians working in clinical nutrition. And we were developing those and putting those into handbooks for delegates that would come to the clinical nutrition update. So what we were doing was we were working hard in the background, and a lot of people involved in that. And then we decided to put out the second edition, which many, perhaps more people will recognise as the black handbook that we had, with the updated logo at the time. And we added some additional sections, identifying patients at risk from disease-related malnutrition, and we put in there what became the BAPN 4 questions that were a simple nutrition screening tool. So can anybody remember? Anybody tell me what the 4 questions were that we used? Have you lost any weight unintentionally? Yes. Are you not eating as much as usual? What's your normal weight? And how tall are you? Yeah. So those, we used those for a number of years before the MUST screening tool was developed. We expanded on nutritional assessment, so we introduced subjective global assessment, so that was the DETSCI work that was around at the time. And this is because we were aware that in other parts of the country or, internationally, people were starting to use other tools for screening and assessment. And then we introduced access routes as well, so to make dietitians more aware of the different enteral and parenteral routes that people were using. So we actually wanted members to help shape development. So in 1999, we were asking members what they would like to see included in future guides, and things like guidance on nutritional support in ITU, things like monitoring and disease-specific guidance were starting to come out of our membership surveys. And at the time, we were also working very closely with the universities and liaising on academic programs relating to nutritional support and introducing the pocket guide into the universities and into dietetic departments as well. I know that, we had a bit of a lot of conversations with the BDA who thought that we were perhaps taking over from the manual of dietetic practice, but, it's quite clear that they're two very different tools. So we did several updates, and we've done several updates within all of the guides. And so within the second edition, we did an update where we started to include some of the disease-specific elements and started with diabetes, microbiological control, because at the time there was a lot there going on about enteral feeding, how long you should keep feeds up if you were pre-preparing them, etc. So there was quite a lot of evidence and work being done, particularly with Annette Anderton, who moved that whole agenda forward for many years. Refeeding, people were starting to talk about, and thermal injury, people were interested because at the time there were a number of burns units around the UK and people wanted more information about burns. So then we went on to the third edition of the Pocket Guide, and that was really to build up on more of the disease-specific work that we'd already included. And so we added in the renal, the liver, and the critical care sections. And we updated some of the other sections. And one of the key things that we did around nutritional requirements, and this is the sort of discussion that was really going on for years and years and years about what we should do, how do we do it. So what we did was to take out the Elia nomogram, which we'd had in the previous editions, which helped to give some approximate energy and nitrogen requirements in adult patients receiving artificial nutrition support. And we put in place stress factors, which Liz will talk more about. Liz and Claire Salisbury did a lot of work around looking at stress factors around energy requirements and nitrogen requirements. We also introduced physical activity levels for mobile community patients to fall in line with the saccharin guidance at the time. And because there was so much debate about nutritional requirements, we put in a section about critical appraisal of papers on energy expenditure and requirements. And this was to help dietitians to start looking, because we knew that dietitians were using all sorts of different formulae for different clinical conditions. So this was about just actually saying, okay, well, you know, use this approach to identify whether you're actually going in the right direction or not. And we then introduced a section around managing energy requirements for patients with BMI greater than 30. So we carried on and again expanded and revised the third edition, and by 2004 we'd incorporated MUST, which had been developed in launched in 2003, and we also looked at the monitoring and refeeding sections as well to bring them in line with the NICE guidance on nutrition support of adults that had been published in 2006. And we introduced acid-base. Parenteral nutrition was expanded and updated, and drugs and enteral nutrition were introduced. But there was a call to discontinue thermal injury, and I think that was at the time when there had been many of the burns units had been consolidated really into larger units, and so not as many dietitians were working in that area. So generally, the use by universities and dietetic services continued to grow, and sales continue to improve year on year. I mean, average sales are probably 3,000–4,000 a year, much more when we actually put out a new edition or put out new inserts. We sell to other countries, and the other important thing is there's no price increase over the last 20 years. So you're still paying the same price. So then we came to the fourth edition, which was published in 2011, and really is the edition that you still have today. So all the sections were revised and updated. One of the key things, again, around looking at estimating energy requirements was that we replaced the Schofield equation with the Henry equations. Into assessment, we put some information about calf circumference as an indicator of fat-free mass losses, particularly in older adults. We put in something about bioelectrical impedance analysis, because there was a lot out there around the different equipment that could be used and the value that it might have with certain clinical groups. And subjective global assessment was removed. And again, we added in 3 new sections, which were COPD, bariatric, and the pancreatic section. So moving forward, again, looking at the members, ran a membership survey in November 2016, and we had 477 responses. It went out to the membership, so PENG and non-PENG members. And 80% said it would be useful to have a downloadable copy of the pocket guide. And one of the other things that we were talking about was whether we should have just core sections within the handbook, and then things like the disease-specific elements you could buy individually if that's, you know, what you wanted to do. So that was just a question that we are still talking about. So just interestingly, this is just to show you the sort of the breakdown of what dietitians said that they would like to see sort of currently, if you like, so the top 10, very much as we probably started off with. So requirements, assessment, monitoring, some of the key things, refeeding. I think liver's interesting, but then I think that, you know, we see more and more liver patients on wards, general wards now, so I think that, you know, dietitians are keen to have some information about that. And then the other 10 were obviously based on the current guide as we have it, but, you know, that was, you know, in descending order, what people felt that they would still like to see. And moving forward, what else would people like to see in the guide? So these were the top 10 additional things that people wanted to see. And I think interesting that burns has come up again when we'd taken out thermal injury in the edition before. So we've taken note of this, and we have these on our lists to discuss and hopefully move forward with over the next couple of years. So what's been happening over the last 2 years, really 2 years, while you've been expecting the next edition? So we've had many dietitians involved in looking at the 20 sections that we have in the guide. And the reason that, you know, there is a delay on what we're doing at the moment is because we have taken advantage of looking at the adult nutritional requirements section and actually taking an evidence-based approach and doing some systematic reviews, which this is going to be talking about. And that whole process has taken a long time to complete because of the volume of work. So all the sections have been revised and updated. And so far, most of the chapters we have back, and we're just halfway through the editing process. So yes, we're expecting it to be out in March, and this is really about the discussions that we're having about making it electronically available, and part of that work is well underway, and we're just really thinking about, you know, how we make it available in a locked down format so that you know, you're not able to unfortunately share it with others, but we're also looking at, you know, whether we can have some interactivity really between the handbook and the website, which is actually so that you'd have some of the, you know, you could do some of the calculations maybe on the website, but you would also have the handbook for extended information. So thank you very much.